Okay, let's unpack this. Picture this scene. Honeymoon bliss, that exciting new chapter with your partner.
Yeah.
Then, something unexpected happens, a really deeply personal hurdle. Intimacy just becomes impossible, maybe marked by discomfort, distress.
Hmm.
What you might be encountering there is jinya, jingyeonggrayon, or as it's known in English, vaginismus.
Exactly. And in, well, straightforward terms, shamanyu involves these involuntary muscle spasms in the vagina.
Right.
They actually prevent penetration of any kind. It's not about a lack of desire at all.
No.
It's a genuine physical response that can, well, profoundly affect an individual and, of course, their relationships.
So for this deep dive, we've got two really interesting sources lined up to help us get to grips with this.
Okay.
First up, there's a YouTube video. It's from Haramonse, and it's called Shinye.
Which translates to something like,
The Reason Why Vaginismus Ruins Marital Life.
yeah.
It offers a pretty direct, maybe even blunt look at how this condition impacts the dynamic between partners, their sexual compatibility.
Okay. Direct perspective there. And the second source.
And to give us more of a, let's say, clinical foundation, we'll also be exploring excerpts from a presentation.
Right.
This one's titled Anai Undio, meaning the causes and treatment of vaginismus that makes sexual life impossible.
So that sounds like it'll give us the medical background.
Exactly. It should provide a deeper understanding of the condition itself, its classifications in the medical world, the various factors that might contribute to it, and crucially, the treatments that are available.
Sounds good.
So our mission today is really to get under the skin of Sha. We want to understand what it is at its core, what might be setting it in motion, how it can impact that crucial dynamic of a marriage, especially looking through the lens of that YouTube video, and then what pathways exist for treatment, drawing on those insights from the presentation.
So equipping the listener, you, with a clear, comprehensive understanding of this, well, often misunderstood challenge.
Exactly.
Okay, let's begin by really clarifying what shet is. As we mentioned, it's that involuntary tensing of vaginal muscles making penetration impossible.
Right.
And the presentation, the denial no one, it expands on this quite nicely. Slide 2 tells us very directly that vaginal insertion is simply not possible in this condition.
And this isn't just like a feeling someone has. It's actually recognized by the medical community, isn't it? It's not purely psychological.
Oh, absolutely not. Both the DSM-5 and the ICD-11, which are basically the standard diagnostic manuals used by healthcare professionals. They both include this condition. The DSM-5 classifies it under something called GPPPD.
GPPP.
Yeah, genitopelvic pain penetration disorder. Yeah. And the criteria for that include things like persistent pain during attempted intercourse.
Okay.
Significant fear or anxiety about this pain, or even just the act of penetration itself.
Right.
And also a noticeable tensing of the pelvic floor muscles during any attempts at vaginal penetration.
So it's really not just one symptom, is it? It sounds like a collection of interconnected issues.
Precisely. And the ICD-11, it uses the term SPPD, or sexual pain penetration disorder.
This PPD. Okay.
And it describes it in a very similar way, emphasizing these ongoing difficulties with penetration, often linked to those involuntary muscle spasms or tightening.
Yeah.
Alongside significant fear or anxiety about anticipated pain or actual pain during attempted penetration. What's kind of fascinating here is that both of these classifications, they clearly acknowledge that sachet isn't just in your head or purely a physical problem.
Right.
It's more like a complex interplay of pain, anxiety, and muscle response that really significantly impacts someone's ability to have intercourse.
Now, how widespread is this? It sounds like something that could feel incredibly isolating for someone going through it.
That's a really important point to consider, definitely. Slide 3 of the presentation gives us an estimated prevalence for vaginismus.
Okay, what are the numbers?
It suggests that it affects somewhere between 5 and 17% of women.
Wow, 5 to 17%. That's actually a higher number than I might have guessed.
It is quite significant. And the slide also makes an interesting observation that it seems to be more commonly reported in cultures that have sort of more conservative views around sex.
Interesting correlation.
And perhaps, quite tellingly, it's highlighted as a notable reason why newly married couples end up seeking medical help, or sometimes get referred to fertility clinics.
Right, because it directly impacts plans for starting a family, potentially.
Exactly. It really underscores the potential impact it can have on a couple's hopes and plans right from the start.
So what actually sets shut in motion. Is there like one specific cause or is it more complicated?
It's generally more complicated. Slide 4 of that presentation outlines several factors that can contribute to it developing.
Okay.
One really significant aspect is a fear of pain.
Makes sense.
Yeah, this anxiety can stem from all sorts of concerns. Worries about the hymen, maybe previous experiences of vaginitis or uterine fibroids, infections in the genital area, other sources of vulvar pain.
So if someone anticipates that intercourse will be painful,
Their body can just instinctively tense up, almost like a protective response.
like a defense mechanism that's gone into overdrive, maybe?
Kind of, yeah. Now, the presentation also touches on the topic of sexual trauma.
Right. That often comes up in these discussions. Is that considered a direct cause?
Well, it's a factor that is frequently mentioned, and you can understand why.
Right.
However, the presentation actually points out that while it's a commonly cited association, systematic research that definitively establishes sexual trauma as a direct cause is still, well, lacking.
Ah, okay. So it can contribute, but it's not the only explanation, or maybe not even the primary one in every case.
Exactly.
Yeah.
While trauma can certainly contribute to fear and anxiety around penetration, it's not the sole explanation for every case of gua sha.
That's interesting. The presentation also mentions that there were past beliefs linking it to male partners or relationship issues.
Yes, historically, there might have been assumptions floating around that these factors played a primary role.
Right.
But the presentation emphasizes that, again, rigorous systematic research hasn't really provided strong support for those as direct causes of the condition itself.
So it's not necessarily the partner's fault or an inherent problem in the relationship causing the physical response.
Not directly, according to the current understanding highlighted here.
So what are some of the more significant factors that do seem to play a role according to the presentation?
Well, one key aspect highlighted is the impact of inadequate or maybe negative sex education,
Ah, okay.
or perhaps an upbringing strongly influenced by quite conservative religious beliefs.
How does that connect?
Well, if someone grows up with negative associations about sex, or just a lack of clear, positive understanding about their own body and sexuality,
Yeah.
that can certainly contribute to anxiety and fear surrounding penetration later on.
That makes a lot of sense. So it seems like it's often a combination of factors, maybe the physical potential for pain, the underlying psychological elements like fear or anxiety, and even these broader societal or educational influences.
Exactly. It's usually multifaceted.
Now, the presentation mentions something called the fear avoidance model. What's that all about? Sounds important.
It is, yeah. It's a really useful way to understand how G-key can become this kind of self-sustaining cycle.
Yeah.
Slide 5 actually illustrates this model quite well.
Okay, walk us through it. How does it start?
It typically begins with an initial fear or anxiety, maybe about the potential for pain or just discomfort during penetration.
Okay, so that's the starting point, the fear.
Exactly. This initial fear then leads to an increase in muscle tension
Right.
and also a heightened sense of sensitivity in the pelvic area. The body braces itself, essentially.
Okay.
So when penetration is attempted, this tension can then result in actual pain, or at least negative physical experiences.
Which would obviously reinforce the fear.
Precisely. These negative experiences, in turn, reinforce the negative expectations about any future attempts at intercourse.
So it becomes a kind of self-fulfilling prophecy of discomfort.
You got it.
Yeah?
These reinforced negative expectations can then lead to what the model calls catastrophic or negative thoughts about sex and penetration.
Like, this is always going to hurt, or I can't do this.
Exactly those kinds of thoughts. And as a result of these thoughts and expectations, the individual might develop avoidance behaviors.
Trying to avoid situations where sex might happen.
Right, consciously or unconsciously, just trying to prevent any situation that might lead to attempted penetration. And this avoidance, unfortunately, then reinforces the initial fear and anxiety.
And the cycle keeps going.
It keeps the entire cycle going, yes.
Wow, that sounds incredibly frustrating and, well, isolating for the person experiencing it.
It really can be.
Okay, let's shift gears a bit now and turn our attention to that YouTube video. It offers a, shall we say, particular perspective on why shahia can be so detrimental to a marriage. What's the core argument it's putting forward?
Well, the video presents a pretty direct argument, as you said earlier. It's kind of rooted in what it describes as the fundamental biological drives that it claims underpin marriage.
Biological drives, okay.
Yeah, it suggests that while couples often believe, they marry primarily out of love and emotional connection,
Which they do.
of course. But the video argues there are also strong underlying biological instincts at play. And these instincts might manifest with different primary goals for men and women within that marriage structure.
Okay, here's where it gets really interesting, perhaps a bit controversial. What are these differing goals that the video highlights?
So the video posits that men are primarily driven by a biological imperative to seek regular and, quote, legitimate sexual intimacy within the context of marriage.
Driven by the need to pass on genes, is that the idea?
That's the implication, yes. On the other hand, it suggests that women are more fundamentally driven by the need to secure a stable and supportive environment,
Right.
ideally provided by a committed male partner in which to safely raise offspring.
So the video is essentially suggesting that while love is undoubtedly a massive factor, there are these deeper, maybe subconscious evolutionary drives at play, leading to potentially different core priorities within the marriage for men and women.
That's the argument it puts forward, yes. And building on that foundation, the video goes on to explain how a lack of sexual intimacy in a marriage, especially when it's due to a condition like SINA, can be experienced and interpreted quite differently by men and women.
Okay, how so? What's the contrast the video draws between these experiences?
Well, the video asserts that men may experience a greater sense of loss and profound frustration when sexual intimacy is absent in their marriage.
Why specifically men, according to this video?
It frames this as a failure to fulfill what they might perceive, perhaps unconsciously, as their primary biological purpose within that relationship.
Mm.
It suggests this potentially leads to feelings that their efforts in, say, providing and caring for the family aren't being reciprocated in a fundamental way.
Mm.
The video even suggests that some men view sexual intimacy as the ultimate expression and, like, the completion of love within the marital bond.
So, from that specific perspective outlined in the video, for some men, the absence of sex might feel like a core, almost primal need isn't being met.
That's the crux of its argument for the male perspective, yes.
Okay. And what about the perspective it offers for women in this situation, according to the video?
The video suggests that women, even in the absence of regular sexual intimacy, might still feel that their primary need, again, according to this biological framework for a stable and supportive environment, is being adequately met.
Right.
Therefore, they might not perceive the lack of sexual intimacy as quite the same level of fundamental flaw or crisis within the marriage as some men might, according to this view.
That difference in perception?
Mm-hmm.
Wow, that could definitely create a breeding ground for misunderstandings and a real lack of empathy if these underlying perspectives aren't openly communicated and understood between partners.
Yeah, absolutely. The video really emphasizes the potential for a significant lack of empathy to arise between partners, precisely because of these differing fundamental viewpoints on the role and importance of sex within the marriage.
Yeah.
It highlights the really unfortunate reality that a husband's attempts at intercourse, however well-intentioned they might be, can inadvertently traumatize a wife who's experiencing a joy, which then further reinforces that fear avoidance cycle we talked about earlier.
It's like a feedback loop of distress.
Yeah.
And it's not just a one-way street, is it? The video also touches on how the husband can be psychologically affected by this situation, too.
Yes, it does. It discusses how a husband can experience significant psychological distress himself, stemming from his wife's pain and her avoidance of intercourse.
Right.
And this can potentially lead to what's known as psychogenic erectile dysfunction.
Where the ED stems from psychological factors rather than physical ones?
Exactly. The inability to achieve or maintain an erection stems from psychological stress or anxiety, not an underlying physical cause.
Yeah.
And that obviously creates a really complex and emotionally challenging situation for the couple to navigate.
Wow. The video uses some quite powerful, maybe even stark imagery to describe a marriage that lacks sexual intimacy, doesn't it?
It does indeed. It employs analogies like a marriage walking on thin ice or being as fragile as a sandcastle.
Wow.
Yeah, to really underscore the perceived vulnerability and instability of a marital foundation that lacks sexual intimacy, at least according to his particular perspective. It suggests that without this fundamental aspect, the very core of the relationship is weakened and susceptible to collapse under pressure.
That's a very strong statement. It also touched on the reasons why some women experiencing Xiam might be hesitant to seek professional help right away. What were the reasons it gave?
The video mentions that some women may feel a significant hesitancy, maybe even fear, about seeking treatment because of the treatment process itself.
Ah, okay. Fear of the treatment.
Yeah. The idea of undergoing medical examinations or Really, any kind of intervention in such a personal and sensitive area,
Yeah.
it can understandably feel quite daunting.
Yeah.
And that can create a considerable psychological barrier to actually reaching out and seeking help.
It sounds like a really, really difficult situation from all angles. So, okay, what are the potential pathways to finding resolution? What kind of treatments are available for Shunai?
Thankfully, there are effective treatments. Slide 6 of the presentation outlines several key approaches that are typically employed.
Okay.
And a primary, really crucial focus across all these approaches is breaking that vicious cycle.
The fear avoidance model we talked about.
Exactly. Interrupting that cycle is key.
So, what are the strategies for doing that? How do you break the cycle?
Well, one of the foundational elements of treatment is often the use of vaginal dilators.
Dilators.
Yes, they're specially designed devices. They're often used in combination with progressive desensitization techniques
Okay.
and various relaxation exercises too. This whole process helps the individual gradually become more comfortable with the idea
Mm.
and then the physical sensation of penetration, but in a very controlled and non-threatening environment.
So, it's kind of a process of retraining both the body's physical response and the individual's mental and emotional associations with penetration.
Precisely put. And alongside that, providing accurate information and comprehensive education plays a really vital role in the treatment process.
Just knowing what's happening.
Exactly. Addressing any existing misconceptions or fears surrounding sex, the body, the condition itself, that's essential. Often, simply gaining a clear understanding of what's happening physiologically can significantly alleviate some of the anxiety that's wrapped up with it.
That makes a lot of sense. Knowledge is power, as they say. What about addressing the underlying psychological aspects that might be contributing?
Yeah, exploring any underlying psychological factors is also crucial. Things like general anxiety, perhaps past negative experiences that weren't necessarily trauma, but still negative, or even relationship dynamics.
How is that addressed?
Well, it might involve individual therapy or counseling to work through these deeper issues. And additionally, couple therapy can be particularly beneficial.
Right, bringing the partner in.
Yes, especially incorporating specific exercises like sensate focus.
Yeah.
That can be really helpful in addressing the relational aspects of intimacy and improving communication between the partners about sex and touch.
I recall reading about sensate focus. It's a series of exercises, isn't it? Designed to build intimacy and reduce anxiety around sex by focusing on non-genital touch initially.
That's exactly right. It's a very gradual process. It emphasizes pleasure and connection through non-demanding forms of physical intimacy first,
Okay.
and it progressively moves towards genital touch and eventually penetration, only when both partners feel genuinely ready and comfortable. There's no pressure.
That sounds like a really gentle and helpful approach. Are there other modalities?
Yes, biofeedback is another treatment modality that can be utilized.
How does that work?
It helps individuals gain greater conscious control over their pelvic floor muscles. Seeing feedback helps them learn to relax those muscles, which can be particularly helpful in managing the involuntary spasms.
Ah, interesting. Are there any more direct medical interventions that might be considered?
In some, maybe more complex or persistent cases, yes, surgical intervention might be considered, or sometimes local injections of botulinum toxin, Botox, essentially.
Botox, really?
Yeah, to help relax the muscles. However, these are generally reserved for situations where the more conservative first-line treatments haven't been successful. They're not typically the initial approach.
Got it. So they're further down the line options. Now, let's circle back quickly to the message from that YouTube video. It also strongly encourages seeking professional help, doesn't it?
Oh, absolutely. The video strongly advises individuals and couples experiencing injegya to seek guidance and treatment from healthcare specialists who have specific experience in managing this condition.
Right.
It really echoes the sentiment from the presentation that effective treatments are indeed available, and it emphasizes the critical importance of not delaying seeking help.
And what's the urgency it highlights regarding seeking timely treatment? Why not wait?
Well, the video cautions that delaying treatment for GYA can unfortunately lead to the development of that psychogenic erectile dysfunction in the husband, which we discussed earlier.
Ah, right, the knock-on effect.
Exactly. And that can create a whole secondary layer of complexity in the relationship. It can make achieving successful and comfortable intercourse even more challenging in the future, even after the wife's Shia have been successfully addressed.
That's a really, really important point to underscore. It really highlights how this isn't just an individual issue that one person experiences in isolation, is it?
Not at all.
It profoundly affects the dynamic and the well-being of the entire couple. Precisely.
Yeah.
And the YouTube video also makes another significant point, that maintaining sexual health is a valuable and important aspect of overall well-being
Yeah.
for both individuals and the relationship. It extends far beyond just the biological imperative of procreation that it discussed earlier.
Right.
It argues that a fulfilling and healthy sexual relationship contributes significantly to the overall stability, happiness, and connection within a marriage.
So to kind of bring together everything we've explored today.
Yeah.
Jaw. Vaginismus. It's a genuine and often deeply distressing condition. It's characterized by those involuntary spasms of the vaginal muscles that prevent penetration. It clearly has both physical and psychological dimensions. And potential contributing factors can range from fear of pain, negative or inadequate sex education, right through to that self-perpetuating cycle of the fear avoidance model.
That's a concise and accurate summary, yeah.
Yeah.
And as we've learned from the, let's say, distinct perspective offered by the YouTube video, this condition can have a really significant impact on the dynamics of a marriage.
Potentially leading to misunderstandings and frustration, perhaps stemming from those differing underlying perspectives on the role and importance of sexual intimacy that the video proposed. But, and this is crucial, it's vital to remember the overarching message from both our sources. Effective and varied treatments are available, ranging from practical techniques like vaginal dilation and relaxation exercises to therapeutic approaches like individual or couple therapy and sensate focus, and, in some instances, those medical interventions.
And the really key takeaway, it seems, from both the clinical presentation and the more relational insights of the YouTube video is just the vital importance of seeking professional help.
Definitely.
And proactively working to break that cycle. Ignoring the issue or delaying treatment can, unfortunately, lead to significant and compounding consequences.
For both individuals and the overall health and well-being of the relationship, absolutely.
So here's maybe a final thought for you, our listener, to consider. How does gaining a deeper understanding of this intricate interplay between biological factors, psychological factors, relationship dynamics in our intimate lives, how does understanding that, as starkly highlighted by the challenges of Schnee, perhaps shift the way we approach other difficulties that might arise within those relationships?
That's a deep question.
And maybe what absolutely crucial role does truly open, honest, and perhaps most importantly, empathetic communication play in navigating these deeply personal and sometimes really complex hurdles?
Yeah, it's certainly something profound to continue exploring, isn't it?